Um, I'd like to begin by saying how grateful I am that the National Academies is taking on this critical work, and how honored I am to be part of what has been Terry Cowley's life's work along with her colleague Deanne Clare, to bring the inadequacies surrounding the treatment of TMD into the light and onto the radars of many stakeholders as possible. As I sat here yesterday listening to all the panels present, I felt a shift. I no longer felt like this is an us and them situation, but rather a much needed united front. And for that, I thank you all. So I'll keep my story short as there are more important issues to discuss, but my story, like the other stories that you heard yesterday, provide a glimpse of the gaps, inadequacies, and devastation that have plagued countless TMD patients up until now, and will hopefully inspire a vision of a healthier future for TMD patients. My jaw pain and headaches started at age 11. I had a wisdom tooth pulled at 18, which caused me to faint from the pain. I had trouble eating after that. I was referred directly to an oral surgeon and had my first arthroscopy shortly after, and that was in 1985. My discs were perforated and had torn off. I underwent 5 surgeries between the ages of 18 and 24. At that point, I was told that I needed total joint replacements, but that the technology just wasn't there. So I had to live with it for the next 16 years. And I did live with it, which taught me a lot about our body's ability to adapt. I'll fast forward to 2007 when it was discovered that my right joint had fused, and I was told that it required a total joint replacement. I didn't question the surgeon. I assumed he knew best, and enough time had passed since the Vitek disaster that I figured whatever devices they're using now would surely be safe. I couldn't imagine them risking doing harm to more patients. So I was totally unprepared for what happened following that surgery. I was actually in more pain than before the surgery. At my 6-month follow-up appointment, my surgeon declared the surgery a success because my joint was functioning and my opening was acceptable. But when in tears I began to list my new, more intense pain and flu-like symptoms and the fact that the painkillers I was taking barely touched the pain, he stopped me mid-sentence and said, you need to deal with those issues with your family doctor. In that moment, I felt dismissed and devastated. So according to the surgeon, the surgery was a success. Meanwhile, I was a mess. Now, somehow I had to convince my family doctor and the insurance company that I was in more pain than before the surgery, and I would have to do that without the help of the doctor who performed the surgery. But worse than that was that the one doctor qualified to acknowledge my pain, to explain it, and possibly treat it, had dismissed me and didn't want to hear what I was experiencing. There I was with no one to turn to in dentistry or medicine. Oral maxillofacial surgery is the last stop for us. This is the point where I fell through the proverbial gap between dentistry and medicine into a no man's land. This gap must close. And while we're at it, let's redefine success when talking about TMJ surgery. So the patient is left to take the meager amount of research out there to educate their family doctors and negotiate their own treatment and pain management. They have to deal with the fact that every aspect of their life has been affected, but by what I can only describe as a laundry list of symptoms, which after yesterday we're all very familiar with. So who do we turn to for help with those? You heard Michelle Reardon yesterday list all the specialists that make up her daughter's medical team. I was sent to many of the same specialists because, as my doctor told me not too long ago, I knew you were really suffering, but I knew nothing about TMD, and I didn't know how to help you. All I could do was help rule out what was not going on. Just think of all the wasted time, energy, and money spent by countless patients and insurance companies going to dead-end appointments because our doctors don't know what else to do for us. Family doctors and dentists need to be educated on the complexities surrounding this disorder. I was so excited to hear Mark Dranksholt and James Fricton speak to this yesterday. And now Justin Durham. Family doctors and dentists need to be able to explain to patients the mechanics of the joint, the nature of the muscles surrounding these joints, and about the major nerve bundles just millimeters away from the joint, so that their patients can make sense of the myriad of possible symptoms that they're experiencing. Doctors and dentists should be able to suggest self-management options to try first, recommend hopefully a truly qualified TMJ physiotherapist, and explain that there are no quick fixes. This would go such a long way in reducing a patient's anxiety and fear, both of which just exacerbate TMD symptoms. So, further imaging revealed that one of the screws from my joint replacement had gone through my zygomatic arch and into my temporal muscle. My physiotherapist suspected that, given my pain pattern, the stock joint I had received was too big for my joint space, and I continued to struggle with flu-like symptoms, along with occasional swelling around the joint. I wanted answers. I contacted the company that manufactures the device, and I even made an appointment with the surgeon who designed the device. The pharmaceutical company acknowledged that more patients complained of issues such as mine, but ultimately they came back with, "We just make the device. We're not responsible for how they're put in." The surgeon was very forthcoming about the issues with the device, including biofilm, which he suspected explained many of my symptoms. Thankfully, he did not suggest more surgery, the opposite actually. He felt that despite the evidence of there being issues with some of the screws, and the fossa was pushing into my ear canal, he felt surgery would only do more damage. I was given a prescription for antibiotics to take when the biofilm flared up, and once again, I was left to educate my family doctor about the biofilm, the screw, and the systemic effects of my device. You see, it is not our family doctors who can make these referrals, so none of this information is communicated back to them directly. Again, we really need to close this gap. We have learned through the collective suffering of TMD patients, and I'm not talking about accident victims or cancer patients here, that surgery should be a last resort, and we should not count on it to reduce our pain level and to expect it to only restore a modicum of function. So why do so many people do it anyway? Because there's no science to back this up. Only thousands of people sharing their stories and trying to help others avoid the regret, pain, and isolation that they are enduring. There are no proven safe, effective alternatives. Even finding a physiotherapist that is truly trained to treat TMJ issues and that didn't just take a weekend workshop is a challenge. We're not always told the facts surrounding these devices either, because there really are none, just patient experience and MedWatch reports. There is no registry for these devices, yet, so no real way of tracking them. When the science is sparse, it's hard to know what to believe. So when a surgeon, who we usually trust to be the trained expert, gives us even a glimmer of hope for some relief, many will take it. I was asked to comment on my experience with insurance in terms of accessing care. As we all know, what will be covered by our insurance, or Medicare, Medicaid, I'm not sure what you have here, or what you will have to pay out of pocket, plays a huge role in the kind of treatment you choose or don't choose, and potentially on the psychological state of patients that are left with huge financial debt. Coming from Canada, I've never had to face the prospect that my health could cause me to go bankrupt, or that it could cause me to be a financial burden on my family. That stress and guilt must surely impact one's health and amplify the already heightened feelings of devastation and despair, almost a secondary source of pain. I may be way off, but could insurance companies also be a part of the solution when trying to collect sufficient data? They have a wealth of information when it comes to the effectiveness of TMD treatments. For example, I'm on long-term disability, and every year my insurance company requires both my family doctor and myself to fill out a questionnaire to determine the status of my disability. They want to know what specialists I've sought out, what medications I've tried, and what treatments I am trying out or continuing to access in an effort to improve my condition. They have, in essence, the ability to track my medical history since my total joint replacement and see what has helped and what hasn't. Similarly, I would think auto insurance companies have potentially similar helpful statistics. I was asked to address the following question today. What are the major challenges that exist in accessing effective care? The accessing is not necessarily the problem. Facilities abound that advertise themselves as TMJ specialty clinics. As you've heard from our stories, effective and safe treatment is the major challenge. We heard yesterday that the treatment patients receive at these clinics might actually help or be ineffective, and others may actually cause harm. If they went down the road to a different clinic or specialist, they'll most likely be offered a different treatment option because there are no standards of care and there are no established protocols, because, as has been said numerous times, we don't have the evidence-based research that tells us what treatments work for whom and why. At the point when patients are finding themselves worse off, they will turn to the TMJ Association, their Inspire community, or the various Facebook support pages that we moderate for recommendations on who to turn to or what to do, because nothing is helping. The pain is just getting worse and their opening is getting smaller. They will ask us what drugs to take, what treatments to try. They will ask us to interpret scan results and to tell them how to get through a bad flare-up. They will ask us these questions because they don't know where else to get these answers. In my opinion, these are all questions that should be able to be answered by their primary care physician or dentist or an oral surgeon. It shouldn't be that TMD patients know more than them. So what are my recommendations and priorities for improving care pathways for TMD? You've heard them all before, between yesterday and this morning, but let's just go through them one more time. Increased funding for a registry and for multidisciplinary research, and expand the number of scientists in this field. Next, as has been stated already, it's critical that gaps between dentistry and medicine close. This significant paradigm shift will bring about change for future generations. Thirdly, community doctors and dentists need to be educated on the complexities surrounding this disorder. Lastly, I believe that if we were to look at the big picture, we would at some point need to consider what can be done to prevent TMD. Countries like Sweden and the Netherlands are already doing that, so no need to reinvent the wheel, but proof that it's well worth considering down the road. I am so encouraged by the discussions I've heard over the last 2 days. It really makes me hopeful that the stories of the TMD patients of tomorrow will be very different from the stories of the TMD patients of yesterday. Thank you.